In the United States, the paramedic is a paraprofessional whose primary focus is to provide advanced emergency medical care for critical and emergency patients who access emergency medical services. This individual possesses the complex knowledge and skills necessary to provide patient care and transportation. Paramedics function as part of a comprehensive EMS response under medical oversight. Paramedics perform interventions with the basic and advanced equipment typically found on an ambulance. The paramedic is a link from the scene into the healthcare system. One of the eligibility requirements for state certification or licensure requires successful completion of a nationally accredited paramedic program at the certificate or associate degree level. Each state varies in requirements to practice as a paramedic, and not all states require licensure. Prior to 1970, ambulances were staffed with advanced first aid level responders who were frequently referred to as ambulance attendants. There was little regulation or standardized training for those staffing these early emergency response vehicles, or the required equipment carried inside. Around 1966, in a published report entitled Accidental Death and Disability, the Neglected Disease of Modern Society, medical researchers began to reveal, to their astonishment, that soldiers who were seriously wounded on the battlefields of Vietnam had a better survival rate than those individuals who were seriously injured in motor vehicle accidents on California freeways. Early research attributed these differences in outcome to a number of factors, including comprehensive trauma care, rapid transport to designated trauma facilities, and a new type of medical corpsman, one who was trained to perform certain critical advanced medical procedures such as fluid replacement and airway management, which allowed the victim to survive the journey to definitive care. During the 1960s, a Los Angeles cardiologist named Walter S. Graf became concerned about the lack of actual medical care being given to coronary patients during emergency transportation to a hospital. In 1969, while serving as president of the Los Angeles chapter of the American Heart Association, he created a mobile criticale care unit consisting of a Chevy van, a registered nurse, and a portable defibrillator. The same year, his patient Kenneth Hahn, a member of the Los Angeles County Board of Supervisors, persuaded the supervisors to approve a pilot program to train county firefighters as Mobile Intensive Care Paramedics. A change in state law was necessary to allow personnel other than doctors and nurses to render emergency medical care. Hahn recruited two state legislators who wrote the Wedworth-Townsend Paramedic Act of 1970, signed into law by Governor Ronald Reagan on July 15, 1970, despite opposition from doctors, nurses, and attorneys. Paramedic training began the next month at the Freeman Memorial Hospital under Graf's direction. It was the first nationally accredited paramedic training program in the United States. Other communities in the United States were also experimenting with advanced emergency medical care. Pittsburgh's branch of Freedom House Paramedics are credited as the first emergency medical technician trainees in the United States. Pittsburgh's Peter Safer is referred to as the father of CPR. In 1967, he began training unemployed African American men in what later became Freedom House Ambulance Service, the first paramedic squadron in the United States. Almost simultaneously, and completely independent from one another, experimental programs began in 3 U.S. centers: Miami, Florida, Seattle, Washington, and Los Angeles, California. Each was aimed at determining the effectiveness of using firefighters to perform many of these same advanced medical skills in the pre-hospital setting in the civilian world. Many in the senior administration of the fire departments were initially quite opposed to this concept of firemen giving needles, and actively resisted and attempted to cancel pilot programs more than once. In Seattle, the Medic One program at Harborview Medical Center and the University of Washington Medical Center, started by Leonard Cobb MD, began training firefighters in CPR in 1970. Dr. Eugene Nagel trained City of Miami firefighters as the first U.S. paramedics to use invasive techniques and portable defibrillators with telemetry in 1967.